At your candidacy, looking at what kind of a candidate, how you're going to do post-transplant, or looking to see if there's things that you need to do to get yourself in shape. Sometimes you might not have like the best test outcomes. You know, your 6-minute walk might, you know, be horrible, and then you come here, you can see Christina. Yep, maybe I know that. So, and those are just very important things. The other thing is that you don't just do all the testing for testing's sake. Before 2005, it was first come, first served for lung transplant. And then 2005, the lung allocation system came into being. And really what that is a score, 0 to 100. And I apologize to all the people here, I've heard me say this a million times. But all the tests, your 6-minute walk, your PFTs, your heart cath, all your pressures, some of your labs, it all goes into a very big calculation. It's very tough. Trust me, my kids can't even do it. I can't even do it. But what it does is it leverages a score from 0 to 100. 100 is somebody who's very, very sick. If they're not at EPA, they are probably near death. You want to get somebody somewhere in the 30s and 40s, hopefully, or 50s. Depends on your disease process. But all of these tests go in, and your lung allocation score changes. So I was going to go into depth about what each one of those tests were, but I don't think I need to. If anybody has a question about it specifically or why, I'm glad to go over it. I will just say again, it's a long, these tests they're expensive, and it's a lot of effort to get through all that. So
I just wanted to ask you, I saw on the list that sleep study wasn't one of them. And I know one in Fredericksburg, they wanted to have a sleep study.
Yeah, I didn't have all the tests because I was probably doing about 5 slides because there's a possibility. But yeah, if there's a suggestion they might have sleep apnea, you're exactly right. And so, you know, I couldn't put every single detail, but yeah, you know, you even think that you might have some sleep apnea. We like to get that tested because you want to make sure you're getting oxygen at night when you're sleeping. So part of your team, you have your transplant pulmonologist. At UVA, we have Dr. Beaver and we have Dr. Enfield. And they're the medical doctors. They're the ones that are following your whole medical care. And they're talking with you about risks. They're talking about, you're working with your local pulmonologist. A lot of you all here go to Pulmonary Associates of Richmond. They have 100 offices down here. And so, you know, those are your partners in helping tweak your medications. Your transplant surgeon is supposed to, at the end of the evaluation, supposed to help you detail what this is going to look like. Make sure you are a good candidate. Some people are not good candidates for a transplant. You know, they've had multiple surgeries, they've got bad coronary disease, they've had multiple chest surgeries. So this is all trying to put your picture together to see what kind of a candidate you would be. So I didn't put my picture here because it's in way too many places, but I'm just saying I'm the transplant, I'm the pre-nurse transplant coordinator. There's also post-transplant coordinators. But on the pre-side, we're kind of directing your map, directing your course, directing you through this whole evaluation, trying to decide if you need to stop or if you need to hurry it up, tell you the things you need to do. On the post-side, those nurses are calling you once a week, 3 times a week, 3 times a week, that's right. They're seeing you in clinic, they're watching all your levels, and this is a whole other. So the transplant coordinators on both sides of the transplant are very busy, and they're your advocate. They're hopefully we are. There's that roller coaster. It's a roller coaster ride. Social worker. This is another very important part of our team. Looking in to see if this is. I know I love that picture. You're just so nervous. You know, this is huge. This is, you know, and so the social worker is kind of looking at all kinds of aspects of your social care, your social support, I should say, at home. Who's going to come with you? Who's going to be at the hospital with you? And all of these things are getting evaluated all the time. Financial coordinator. That's another part of your team. Wherever you go, you need to get to know all these people really well. This is an important part. Your insurance agents. Oh my gosh, in the last 2 years, all these insurance companies and all the changes and the co-pays, and it's amazing. I don't even know. You're not even thinking about $5 a gallon for gas and driving where you got to go and the hotel and eating. There's a lot to it. There's a lot to There's going to be about 10 slides, but our financial coordinators are getting prior authorizations, making sure that you have an idea of what's going to be coming out of your pocket, because these medications miscarry for the rest of your life.
Does Medicaid pay for any of this stuff, or you gotta have your own private insurance?
Medicaid in Virginia, actually it's not too bad, but a lot of people, I hardly know anybody right now that doesn't have to fundraise. So most people who have Medicaid are fundraising, and our financial counselor will help you. Number 2 is always make sure that your financial screening, wherever you go, is up to date, because you might qualify for discounts. And that's a big deal.
So there's a little girl that, I say little girl because she's little, she's 21, but she goes to pulmonary, has been going to pulmonary rehab with us upstairs. And they've been running a report about her on the news. Because something happened to her funding through Medicare, Medicaid.
Probably Medicaid.
And she's trying to come up with $25,000. And she was at She got it? They got it. Hallelujah. Because they had net flighted her to do, because MCD couldn't do anything else for her. She was in such bad shape.
Yeah.
And we were afraid she wasn't going to make it before she even.
I know who you're talking about, and those are exactly, when I say you turn the corner, that you have to get to the right center that can handle you.
Yeah.
A lot of the kids with cystic fibrosis, they get sick quick,
Right.
and they need to get the transplant.
She's just so precious. She's so precious. So glad to hear it.
That.
Is the evaluation the same for all centers?
Well, I think they're laughing because there's that nutritionist, darn that BMI. How much weight did you lose for your transplant?
60 pounds.
60 pounds, right here. We did not think of this. Stand up and take a bow. Richmond cop. He's a policeman. His son's head of the cavalry. I mean, Richmond cavalry, right?
Yeah, right.
Yeah.
Down there has a question. Raise your hand.
Is the evaluation the same at all centers or?
There's the basics that are the same, but then there's different centers that tack on different things. And also, it's kind of unique to you, but there's the basics, pulmonary function test, the radiology test, and the cardiac workup. Those are all the same, and the blood. Pharmacist, that's your next best person. These are all parts of your team. Once you get all of your elements completed, then every center has a selection committee. Selection committee is not up to one person. It's up to a group of people, the social worker, the financial counselors, the transplant coordinators, the pulmonologists, the surgeons, and it's to look to see if you're a good candidate. The whole idea is for you to have a good outcome. And what an outcome is different at different centers. It doesn't matter. It's not just a cut. It's a quality of life. I can say at UVA that we want to be able to have people sitting in the audience laughing at you after their transplant. That's what you want. You want a quality of life, and you have to decide what it is that you want. And the listing part, a lot of times people, not a lot, I would say there's a number of times when people are deferred. So you might not get listed right away. You might have